Hi guys, good morning and welcome to the podcast. My name is Andy. I'm the clinical lead at ReadyCare. So involved in bringing all the protocol together, doing the research, analysis, and basically kind of powering the sciencey, nerdy side of what we do here at ReadyCare. All right, let's take a look at today's topic, which is what causes high blood pressure, what does the literature show, and what changes can we make to diet and lifestyle in order to lower blood pressure quickly, significantly, but also safely. All right, let me just present a set of slides that I have here. Excellent. Okay. All right. First of all, just looking at the impact of high blood pressure. Now, I won't bore you with this. If you're listening to this and you have high blood pressure, the last thing you want to know about is all of the awful things that can happen with high blood pressure. But it is something that I want to just kind of address very quickly, because sometimes people say, oh, my blood pressure is a little bit on the high side, and sure, I might take medication, or I do take medication, but sometimes I forget. And they don't realize how significant and serious having high blood pressure can be. So it's not just heart problems. It can lead to kidney disease. It can lead to vision problems. It can, damage your small blood vessels in the eye and leave you poor sight later on in life. And that's a good outcome, poor sight or ultimately blindness. And then you've got the obvious things: stroke, heart disease, small blood vessel damage around the body, and so on. So high blood pressure, this is the point that I wanted to get across from this, is it's not something that happens in isolation. It usually happens in a scenario that we call metabolic syndrome. So if you were to look at the literature, for example, and say what percentage of people with type 2 diabetes have high blood pressure, it would be around 80%. What percentage of people who are very overweight also have high blood pressure? It would be a really high number as well. What percentage of people with fatty liver have high blood pressure? And my point here is that all of these things are connected. So sometimes people will say, oh, high blood pressure is associated with type 2 diabetes, is associated with obesity. When the truth is, they're different expressions of ultimately the same root cause, which is actually high insulin levels. So let's talk about that now. So insulin is a hormone that's made by your pancreas that is critical for everything that we need as humans, but also in high levels can cause horrendous damage around the body. So high insulin levels can lead to fatty liver disease, polycystic ovarian syndrome, erectile dysfunction, high blood pressure, type 2 diabetes, sleep apnea. Many hormone positive cancers are both started and driven by high sugar and high insulin levels. So this is a really key point here. The foods that I have shown in the picture, these are the obvious ones: the cakes, the pastries, the crisps, the sugary drinks, all that sort of stuff. So that will spike your insulin levels, because insulin goes high when blood sugars go high. Very important to remember. Now, what a lot of people don't get or miss the boat on is sugar is not the only thing that can spike your insulin levels. Carbohydrates, and more specifically refined carbs, will spike your blood sugar levels. So even foods that we would have considered to be relatively healthy up until a couple of years ago, things like potatoes, bananas, grapes, below-ground vegetables, they're not what you would call a refined carbohydrate or a processed food, but they will spike your blood sugar levels, no doubt. Even porridge, breakfast cereals, there's no sugar in porridge, but the 80 grams of carbs that you take in a bowl of porridge will spike your blood sugar levels, because ultimately, and this is the key thing I want you to take away from today's session, all dietary carbohydrate, with the exception of fiber, which is a tiny part, usually 2 or 3% of what you're eating, all dietary carbohydrate is metabolized as glucose in your blood. So glucose, which is sugar, spikes your insulin levels, and insulin causes high blood pressure. Really important to know. So I'll show you how it does that now in a second. We'll just dive into the science for a second, then we'll come back out to the kind of practical steps you can take. So again, insulin is a hormone that your pancreas makes in response to any food that you eat, and it will also make it in response to protein and fat. But the worst food for your insulin levels, without a shadow of a doubt, are refined carbohydrates. All carbs, actually, if the level is high enough, but refined carbs and sugar in particular. So what happens when we eat bread, rice, pasta, potatoes in large quantities, or added sugars and kind of refined carbs, so that, the cakes, pastries, ice creams, donuts, all that sort of stuff, is Carbs and sugar, remember, they're ultimately the same thing. They boil down to sugar in the blood. Your pancreas secretes a hormone called insulin from the beta islet cells in the pancreas. And when insulin levels are high, what happens is your kidneys retain sodium. Now, bear with me for literally 30 seconds and you'll understand why this is relevant. So, insulin levels are high because your blood sugar levels are high, and the kidneys are told to retain sodium and water. So, you have a big increase in blood volume because fluid follows salt. So, where salt is high in your blood vessels, fluid is high. So, you've loads of fluid coming in now to deal with all the salt. And that increased blood volume puts additional pressure on the arteries. So basically, you have way more fluid in your arteries and your blood volume is much higher. So, you're going to have more pressure. Think of it as a hose. If you've turned up the tap and you've way more volume coming in, the pressure is going to be higher at the other end. So the water is going to squirt out faster. So that's how you get an increase in blood pressure from having high insulin levels. The other effect insulin has on your blood pressure is a kind of a dual effect. So it plays a key role in maintaining what we call vascular tone or endothelial function of your arteries. And basically, your arteries restricting and relaxing are both governed to a degree by your insulin levels because of the action on something called, I won't get too technical, but because of the action on something called nitric oxide, which allows your blood vessels to relax, and something called endothelin 1, which is basically governs the ability of your arteries to constrict. So endothelin 1 goes up, that means your arteries restrict, and nitric oxide production is impaired, meaning your arteries can't relax. So ultimately, high insulin levels from carbs and sugar cause restriction in your blood vessels and inhibits their ability to relax. So now you have tighter blood vessels that can't relax and a larger volume of fluid coming through. So for that reason, addressing high levels of insulin, otherwise known as insulin resistance, is crucial for managing and preventing high blood pressure. Okay, so how do we do that? So the science is very clear. We know insulin levels definitely bad for your blood pressure. And if we look at a low carb diet, so a diet that will lower your insulin levels. So first of all, you're going to have to reduce your sugar intake if you want to be compliant with a low carb diet. So less sugar in the bloodstream, but also less carbs. So less bread, rice, pasta, and so on lowers that insulin level. As we were saying, the job of insulin is to deal with high blood sugar levels from sugar and or carbohydrates in your diet. So by reducing your sugar intake and your carb intake, you can get much better response to insulin. So basically, your body isn't redlining. Think of it like an accelerator in a car being pressed down to the ground when your insulin levels are high, which ultimately, if that goes on for long enough, that accelerator burns out, kind of like any other part could wear out in a car, and you can't produce any insulin anymore, and we call that type 2 diabetes at its worst. And hence the link between high blood pressure and type 2 diabetes, because they're both ultimately caused by insulin. And the reason the low insulin levels will help you is you have less sodium retention and also better blood vessel function, and then your blood pressure goes down. Now, you think of this and you go, well, that all sounds very impressive from a kind of we'll say a mechanistic point of view. So I've laid out the mechanisms, but we've seen this in our clinical practice and our own clinical experience many times. In fact, we see it all the time. So much so that if somebody is on a low carb diet for a couple of months and their blood pressure doesn't go down, we're scratching our heads. We're thinking, God, that's really unusual. There must be something else going on in terms of stress or smoking or a lot of alcohol or something like that. It's actually quite a predictable response. It typically happens, I mean, you see a reduction almost straight away within the first couple of weeks of a lower carb diet. But typically to see the full effect, it's usually a few months, depending on the level of what we call insulin resistance. So what does the research say about this? Well, the research overwhelmingly supports low carb and the more extreme version of low carb, which is a ketogenic diet that would be defined as less than 50 grams of carbohydrates per day. And that's a loose definition, but it's a whole food diet that's very low in carbs and higher in fat and protein. And then the more relaxed version of that would be low carb, which is broadly defined as less than 120 grams of carbs a day. And for context there, most people take in, 300-400 grams of carbs, sometimes more per day. So low carb diet, less than 120. Keto or ketogenic. So keto is short for ketogenic, and ketogenic means to generate ketones. By therapeutically restricting your carbohydrates, your body generates what are known as ketones, like beta hydroxybutyrate and so on. to work on from an energy point of view. So the steps, I mean, I would start gradually, in the sense that it can be difficult to go, I'm not eating any carbs now because I know it's brilliant for your blood pressure and your weight and your cholesterol levels. But reduce your carbohydrate intake down and increase your protein and healthy fats in your diet. Any of you guys who have access to our program and can book a consultation, do book a consultation with myself or Chloe, and we can go through how exactly you do this. But essentially, focusing on whole foods like vegetables, fruits. Sorry, it says lean proteins there. They don't have to be lean. Healthy fats can be animal fats as well. So it can be red meat, butter, cheese, cream, dairy, all that sort of stuff. And then just kind of planning your meals, putting a little bit of effort into having the bad stuff out of the house, the breads, the cakes, the pastries, all that sort of stuff, the snacks, where possible, as much as possible, and all the stuff in that you need to eat to get by. So that's the dietary steps. There's no question as to the more effective way of eating. Any way of healthy eating is going to reduce your blood pressure a bit, but lower carb is definitely the most effective when we look at the clinical literature. Now, if we look at the other lifestyle changes you can make for lowering your blood pressure, so the first one is definitely a low carb diet, and then regular physical activity. I mean, I'm stating the obvious here, but you're going to improve endothelial function, which is your artery function, your vascular compliance, so your blood pressure's ability to expand and relax, your cardiovascular health, so your overall heart health, and also practicing stress reduction techniques. So one driver of blood pressure is a hormone called cortisol and adrenaline, which are stress hormones. If you can treat those, or lower those, I should say, by doing relaxation techniques, yoga, meditation, deep breathing, any of those sort of things, that's going to make a big difference. And meditation has this sort of a airy-fairy sort of a connotation when you hear it and you're kind of sitting there humming, but none of those things have to be the case. You can do something like a Headspace or an app like that, or Calm. Any of those apps are really good for 10 minutes a night, and get into the habit of doing that. Personally, I don't meditate. I've done it before. I find it really difficult to do because I have a touch of ADHD. And for me, meditation is doing something where I can think about nothing but the task I'm performing. So for me, it's golf 3 or 4 times a week, or just being in nature. And actually, golf ticks both of those boxes for me. And then if necessary, if your blood pressure is not coming down, or if your blood pressure is very high, then for sure, consider medication for managing your high blood pressure. So as effective as this way of eating and these lifestyle strategies are, I would still say to someone, if your blood pressure is very high, or your doctor is very concerned about it and doesn't think you can get it under control in the short term by changing your lifestyle, and it's going to take some time, I would definitely consider a blood pressure medication under the guidance of your doctor. It's not for me to advise on medications, and we never do it, Radicare. But that said, I would definitely consult with your doctor about medication at a minimum as just a short-term solution, you know, to keep you safe while you're doing all of these other interventions like exercising, stress reduction, low carb diet, physical activity, and so on. And then you can consider potentially titrating your medication or reducing your medication as your blood pressure comes down under the guidance of your doctor. All right, that is it for now. I wanted to keep this one relatively short. It's pretty straightforward. There's a world of science behind how low carb diets will help lower your blood pressure, and the mechanisms are very well understood. The literature is there to support it. And again, if you do have very high blood pressure and you've just found out, go chat to your doctor, say, look, I know I can change my diet and that will reduce my blood pressure, but he or she can make the call as to whether or not you should go on medication to keep you safe in the short term. Guys, thank you so much for taking the time to watch this. I appreciate you being here, and we'll see you in the next one. Take care. Bye, guys.